Aventura, and I am a proud USA Olympian. As a professional athlete, I have been dedicating all of my life to taking good care of my body, and that is why I come to the Center for Regenerative Medicine.
Hello and welcome back. If you're just tuning in, you're watching The Medicine Man, a global information source for patients out there. Well, today in our studios, joining us exclusively is the president of the Dade County Chiropractors, and that's Dr. Sandra Doman. Welcome, doctor. How are you?
Good. Thanks for having me.
Fantastic. Now, one of your specialties, is also doing yoga. Tell us how you got hooked up with that.
Before I was starting chiropractic school, I had actually developed back pain myself. And so I went to a chiropractor and I got a lot better, probably 70 or 75% better. But what I found is that when I integrate therapeutic exercise, such as yoga and also stabilization and relaxation techniques, I got 100% better. So this is something that I promote for my patients, which is to teach them how to take care of themselves outside of my office.
Fantastic. This is a big thing because, as you know, with neck pain and back pain, you can't just treat it. You got to stretch the areas for it to get really better. So instead of you telling people, listen, just go stretch, you invite them for a class in yoga, right?
Well, in my office, I teach specifically for injury prevention and athletic performance. But from there, a different passion that I have is actually teaching yoga teachers about how to work with people who have musculoskeletal injuries. So typically, if I get somebody better from neck or back pain, shoulder pain, I will typically also connect them with a good local yoga teacher in the community that they can see outside of my office.
Fantastic. Now, you brought up neck pain. Neck pain is huge, all right? A lot of people get it. How big is it? How common is neck pain?
It's something that I see every day, and that's what keeps the lights on in my practice. Unfortunately, over time, whether it's sitting through school for so many years or the jobs that we have, a lot of us sit in a hunched over position for many hours per day. And what that does, it pulls the spine out of alignment and creates chronic neck pain. The reality is, when it comes to spine pain, structure dictates function.
Okay. Now, we have a video of you in your office, and I want to ask my director to show that video. Right now, what are you doing to this patient?
Okay, so this is actually over at Gulfstream Park, where I treat professional horse racing jockeys.
This guy's a jockey.
Yeah, this is a jockey. This is Corey Lannery. And these are by far some of the best jockeys actually in the entire world are right here at Gulfstream Park. So what happens in a lot of these horse racing jockeys, as well as my desk jockeys who are hunched over, is these guys are in a forward flex position racing, the equestrian version of Ferraris every single day, 7 days a week. So a lot of them have chronic neck pain, and what you see that I'm doing here with Corey is I'm actually breaking up sticky, adhesed muscle tissue that pulls his shoulders forward, pulls his upper back out of alignment, and creates neck pain. So I like to take an inside-out approach or like a front to back so that when I open up the front here, he's able to maintain his alignment better.
Do you feel that, you mentioned that, earlier you mentioned to me that you feel that neck pain is common in jockeys, or right?
Extremely.
Do you think they're getting this neck pain because the way they're sitting or because they're galloping and they're,
I mean,
or a combination of both?
It's probably a combination of both, but the way that I treat them is literally no different than how I treat a lawyer or an accountant or somebody who sits hunched over at a desk for 8 to 10 hours a day. The chronic neck pain is exactly the same. And if you have to sit in a forward flex position all the time, it's absolutely crucial to come up with a more long-term solution to this problem.
And here you were making an adjustment to this patient. We're watching the video. Let's ask the director to put that video back on again, please. Mm-hmm. You are doing adjustments, right, Doc?
Correct. And so what I'm doing here is what I commonly find is when people have neck pain, they want to treat the neck. They want to adjust just the neck or get massage just in that area. But what you can see that I'm doing with him here is I'm actually adjusting his upper back, the upper thoracic spine. I find that this area, from people who sit at a desk too much or have long commutes, it's these bones that come out of alignment. And so once I get them moving again, I also give the jockeys as well as patients stabilization exercises to help keep it in alignment.
And then do you teach these people how to do yoga movements, like something like What is one of the best yoga movements, in my opinion, for neck pain and back pain is sun salutation. It's simple, and people can learn it right there in the office. I mean, I teach that to my patients here.
That's great.
Because I used to do some yoga as well.
Nice.
Not as much as you, but some. Roman Garcia, I want to go to you at this point, please.
Yes, doctor, what muscle groups should people that are watching this show, should they focus on to try to maintain as flexible as possible? Are there particular muscle groups that are more important than others?
Absolutely. And that's actually kind of a deal that I have with patients once they're accepted into my practice if I'm going to treat them. The deal is that whatever I do in my office, if I reintroduce alignment and healthy tissue back into their body, that I need them to be stretching all the muscles on the front side of the body, okay? So if I put everything into alignment on the back side, I show them how to stretch their pec muscles, the pec major, the pec minor, anything that's going to bring them holding tight into a forward flex position. It's only from there that I can give them mid-back exercises, which will then hold them in that position.
And when you correct somebody's structural structure, how easy or hard, how hard is it for them to maintain that position, considering that you're taking them out of a position that they've been in for so many years? Is it difficult?
You know, it depends on the age and the willingness of the patient. There's a difference between my treating a 20-year-old with a first onset of neck pain while the tissue is still soft, they might just take a couple visits and some exercises, versus somebody who might be 60 years old who knows how many years they've been sitting in that forward flex position. But what I find is if I have a willing patient who commits to doing the exercises and changing basically how they sit in their lifestyle, that is a person who will get better in my office.
And most patients that come with cervical problems, is it correct to say that there's always some issues in the thoracic, in the upper thoracic region?
I would say from the people who come into my office with chronic neck pain, unless it's an overt sports injury or a car accident, I would say yes, 100% of the time I find structural problems in the upper back.
Are there always associated neurological symptoms associated with neck issues?
Not necessarily. You know, there's many flavors of neck pain, which is why it's so important that I do an orthopedic, neurological, and chiropractic exam on the first visit. You know, if you just have general compression from sitting too much, that's something I find to be pretty easy to treat. I had a patient earlier today that the only manifestation of her neck pain was she had shooting pain down into her arm. So the question is, where was the pain coming from? And it was coming from compression in the nerves that were leaving her neck.
When an individual has radiating pain going down into the arms, is it always neurological in what's causing it? Or could it be muscle or bones?
That's why a really good history and exam is so important, because you know, when you have neurological symptoms into the hand, I need to look into their history. They might have diabetic polyneuropathy. It is absolutely crucial. That's why you see a chiropractic physician or somebody else who's trained in differential diagnosis to make sure that you are treating the right source of the discomfort.
Now, a neurological condition on somebody that's suffering from chronic neck pains is not always necessarily related to a herniated disc. Is that correct to say?
Absolutely. Just like the young lady that I had earlier today, I determined she did not have a herniated disc, but she had something else called thoracic outlet syndrome. It's actually really common. And so for her, what I'm going to be able to do is help put the spine back into alignment, and I'm going to help to soften and break up a lot of the muscle tissue that's gotten so hard in between her neck and this armpit area, much like stepping on a garden hose. Okay? If she had tingling into her hand and arm, if I'm able to take the foot off the garden hose in these areas, which is just over tight muscles, she's going to stop having tingling into her arm.
And would that condition be something that the probabilities of it occurring be very high for somebody who assumes these forward posture positions, the thoracic outlet syndrome that you just described?
Absolutely. The reason she had developed thoracic outlet was actually from breastfeeding 2 babies. But for most people, when I have thoracic outlet syndrome, it's from sitting in the forward flex position.
And can somebody who's been in these abnormal postures for a prolonged period of time and develops these connective tissue contractures, could these connective tissue contractures cause a malalignment of the spine?
Without question, which is why I think it's so important in my office that I address not only the spinal alignment, but all of the connective tissue, muscle, ligament, tendon, fascia issues that might pull the spine back out of alignment.
And would the reverse also apply? Could a problem in the spinal column cause connective tissue issue?
Potentially, if it's a little bit more serious, like if you do have, in reality, a pinched nerve, that's something that I'm going to look for down the line is even signs of atrophy or something into the hand. If they have muscle weakness and paresthesias, that's where it can cause contractures.
Now, you mentioned earlier that you work from the inside out. Would it be fair to say that most traumas that patients expose their bodies to, it occurs also from the inside out? In other words, affecting the spinal column before it affects the soft tissue?
That's what I find. That's what I find is, like I said before, structure dictates function, which is why it's absolutely crucial to examine the alignment and movement of the spine, correct that as the central architecture to the wellness of and function of the entire body.
Are there any red flags that somebody should be paying attention to in their bodies that will say that there's a lingering cervical problems or somewhere in the spine that's about to become very serious? Is there a red flag symptom?
Yes. If you come into my office with a stiff neck and fever, then my office is not the place for you. That could be meningitis, and that's an emergency. So a fever, headache, maybe a little bit of nausea, that's potentially an emergency, and it's important that we get you to the right medical physician or emergency center.
That's the primary symptoms of a meningitis, which is the stiff neck that most patients complain about.
Stiff neck and fever, flu-like symptoms. And so, like I said before, that's why it's important to do a thorough examination before you even lay hands on a patient.